HIV and AIDS have been a major public health crisis in South Africa since the late 20th century, with the country experiencing one of the highest infection rates in the world. The epidemic gained momentum in the 1990s due to government inaction and misinformation, but significant progress has been made over the years. Today, around 7.8 million South Africans live with HIV, though antiretroviral therapy, ART, has drastically improved life expectancy. USAID has played a crucial role in combating the epidemic through initiatives like PEPFAR, which has funded treatment, prevention, and education programs. Recently, groundbreaking research on an HIV cure, including gene editing therapies and long-acting injections, has shown promising results, offering hope for a future without HIV/AIDS in South Africa and beyond.
The United States has terminated thousands of life-saving grants globally, including HIV, malaria, and humanitarian aid projects. The PEPFAR, the President's Emergency Plan for AIDS-funded HIV organizations in places such as South Africa, and other grants to hundreds of African and HIV groups providing life-saving services, has been terminated with immediate effect. And this has sent shockwaves around the global health community. In January, President Donald Trump had announced an executive order to freeze all foreign aid for a 90-day pause to assess whether projects were consistent with his policy aims. Now, in the hours after the Trump administration announced it was cutting some $60 billion in funding, termination letters arrived at NGOs across the world. The letters said that programs providing life-saving assistance against hunger and disease and performing other humanitarian work were being ended. The letters further said that the programs were being defunded for convenience and the interest of the US government, and major United Nations health programs were amongst those to get termination notices, including the UNAIDS, the Stop TB Partnership, and Scaling Up Nutrition, as well as projects helping displaced people. In South Africa, all 44 South African HIV programs through USAID have been terminated. South Africa has the highest burden of HIV in the world, with 8 million people living with the virus. It also runs the biggest HIV program in the world, providing treatment to about 5.5 million people. An alliance of health groups said that the cuts are a crisis and people will die. Now, the head of the leading Desmond Tutu HIV Foundation, Linda Gale Becker, said that a halt in the US funds to South Africa HIV/AIDS programs could lead to more than 500,000 deaths in a span of just the next 10 years.
The world is baffled about what has happened, about the announcements. We have been fighting the scourge of HIV, AIDS, TB, and malaria together for more than 20 years as a global community, and depending very much also on global funding. But on the South African side, as you know, we are running the world's biggest HIV counseling and testing campaign. At 5.5 million people are on ARVs. No other country comes anywhere near that. The total amount spent in this campaign is 44.4 billion rand. And PEPFAR contributes 17% of it. The rest is mostly our own fiscus and some other funders, like Global Fund. Now, where are we going to be affected? PEPFAR has got a presence and is helping us in 27 districts out of the 52 districts of South Africa. These are the 27 most affected districts in the country. And so the district that will be affected will be 5 in the Eastern Cape, 2 in the Free State, 4 in Gauteng, 7 in KwaZulu-Natal. You'll understand why, because KwaZulu-Natal is the most affected province, 2 in Limpopo, 3 in Mpumalanga, 3 in Northwest, and the Cape Metro in the Western Cape. Now, I got late here, ST, because we're still having meetings about this to try and compile, to find out exactly how much is the weight of the problem on our shoulders. We had arranged a meeting with the Minister of Finance, which was scheduled for 1 o'clock. Unfortunately, it was postponed. But I must also add, most of the people who are funded from PEPFAR are the ones who told us that they've been written letters to stop because of the review. We as a government, whether DERCO, we checked with them, or health, or treasury, where the money is going, we have not as yet received any letter whatsoever. We hear from the clinics, especially vets, where most of the clinics are run under vets. So that's where we are. We will compile and finalize the matter. We'll meet with Treasury. So the information I'm giving you is a stopgap information in the meantime. Thank you very much.
We are encouraged by the great progress the country has made towards ending HIV and AIDS as a public health threat. By the end of March 2024, 96% of people living with HIV knew their status. 79% of these were on antiretroviral treatment, and 94% of these were on treatment with virally suppressed conditions. Now, to ensure that we reach the target of 95, 95, 95, which has been set by the World Health Organization, we will this year launch a massive campaign to look for an additional 1.1 million people who are not yet on treatment. We are concerned about the potential impact of the decision by the United States government to suspend some of its funding for HIV and TB programs in African countries for 90 days. Now, this funding that we get accounts for about 17% of our country's HIV spend. We have been able, over the years, to provide funding from our own resources, our own fiscus, for our HIV and TB programs. We are looking at various interventions to address the immediate needs and ensure the continuity of the essential services that we might lose if this funding does not come through.
South Africa has reportedly developed an HIV cure. One university in South Africa carried out a trial to cure HIV. And that trial turns out to be positive. It was first trial, but it was positive. They wouldn't have done this if US did not cut their aid to South Africa. Africa has all the possibility to do greater things. Our dependency on the Western world is what is killing us. We pray that this trial comes out successful and then the drug be released to the whole of Africa. Peace out.